Now join us for a conversation on how AI is shaping healthcare, decision-making, and patient outcomes. Please welcome Ed Baker, Chief Product Officer, Whoop; Aashima Gupta, Global Director of Healthcare Strategy and Solutions, Google; Munjal Shah, Co-founder and CEO, Hypocratic AI; and moderator David Sachs, White House AI and Crypto Czar.
All right. All right, it's great to be with all of you today. I think this is an exciting panel for me because we get to talk about some of the positive applications of AI. All we really hear about in the media these days is bad things about AI. It's going to put everyone out of work, or it's going to lead to the Terminator. Anyway, it's a lot of really negative scenarios, but I think we're going to hear today from our panelists how AI is really transforming healthcare and creating many more opportunities for patients and caregivers to prevent illness, to treat illness, and for the healthcare system to reduce its costs. So let me open it up to you guys. Ed, maybe I'll start with you, and maybe just go to each of you and hear, first of all, I guess maybe describe to the audience what your product does, and then what you see the opportunity with AI being. And we can just kind of go around.
Okay, great. Well, thank you, David, for having us here today. My name is Ed Baker. I'm the Chief Product Officer at Whoop. And for those of you who haven't heard of Whoop, it's an AI wearable. You put it on your wrist and you wear it 24/7. And our mission is to unlock human performance and health span. So in the early days of Whoop, we started off more focused on elite athletes. Our first 100 members included people like Michael Phelps and LeBron James. But these days, millions of people are using Whoop, and it's really anyone who has a heart can benefit from wearing Whoop. It basically helps you live a longer, healthier life. And we are using AI to basically interpret all of these signals that your body is telling the strap 24/7, all the biometrics, and it takes that and it tells you things about your body. We've condensed it to something we call your Whoop age. It's basically your health span, and it's a measure of your biological age as opposed to your chronological age. So our mission is to add more healthy years to the planet as measured by people improving their Whoop age. And we believe that over time, we can add 1 billion healthy years to the planet. So that is our company's North Star, is to add healthy years to the planet.
And you were just saying that Brian Johnson is a user, because I know he's tracking.
Yeah, he's actually one of our top users. In terms of his Whoop age, I think is quite lower than his chronological age. So he's kind of like best-in-class biohacker who does everything right. But yeah, we have 9 contributors that help determine what your Whoop age is. We've worked with the Buck Institute to come up with this algorithm, and it includes things like sleep consistency, sleep duration, how many steps you're doing every week, how much heart rate zone time you have in different heart rate zones, and a handful of other things like that.
Great, thank you. Aashima, let me go to you. You are the head of healthcare for Google Cloud. I guess tell us what Google Cloud is doing in healthcare, and how do you see the opportunity in AI?
First of all, thank you for having me here. Google is a consumer company, and what I represent here is Google Cloud, which is the enterprise side of it. At Google, we strongly believe the healthcare breakthroughs will change the world and bring hope to humanity, but only through thoughtful collaboration with the ecosystem. So in my role in Google Cloud, we work with enterprises, which is hospitals, integrated networks, universities, startups, both Munjal and Whoop run on Google Cloud, as an example. And from healthcare specific, we have built products that speak the language of healthcare. What I mean by that is, when you think about a patient's data, if it's electronic health record, there are different formats like HL7 and FHIR. So we natively support interoperability, get that data from, so we have the healthcare data engine, healthcare API. And second is we then have modalities for imaging, like radiology, pathology. How do you get the data into the cloud? So think of as a platform built for healthcare organizations, and then they build innovations on top of that. Innovations like, for example, 2022, we were the first one to launch MedPalm, which was our first AI model that passed the US MLE exam. Since then, we have now made that part of Gemini. So we operate at every stack. So Google Cloud has over, I would say, 30 million developers leveraging Gemini. Some of them are from healthcare. We have 8 out of 9 AI labs running on Google Cloud. And my role here is to work with the ecosystem, build helpful products tuned for healthcare. Another one is healthcare search. Healthcare data, we all know, is hard to find. So we have built healthcare-specific ontology, leveraging open standards like FHIR to be able to search, to be able to summarize the data. So we operate at that database layer and the platform, and then leverage Gemini and frontier models to solve healthcare use cases.
Excellent. And I want to come back and talk more about electronic health records, because I know that's a big area right now where I think AI can help. But let's just hear from Munjal first, who I've known for, I don't know, 25 years.
Something like that, yeah.
We were both working on...
Back when we were 2 years old.
Yeah, we were both working on eBay-related startups, back in the late 90s, early 2000s. We were comparing, you reminded me that this was PayPal, and we ended up selling that company to eBay. But in any event, you're working on a company now called Hypocratic AI. Why don't you tell us how this works?
Yeah, so Hypocratic AI is building a healthcare agent that operates within the scope of nursing. So we basically call patients on the phone, we do care activities, and help them with post-discharge instructions to make sure you follow your doctor's instructions, or pre-op calls to make sure you're preparing for your operation, or just generally checking in on your blood pressure, et cetera. So we've done about 8 million patient calls. So our focus is patient-facing clinical interactions. And so to do that, you got to be safe, and you got to prove you're safe. So we've done 8 million calls to patients now without one safety incident. We built a very unique large language model and large language model architecture. We actually use 31 models together to reinforce, because honestly, a model checking a model is still safer than one model almost any way you cut it. And we've signed up 40 health systems and another 5, that basically most of 5 big payers, as well as a bunch of pharma companies as well. And so, we believe that there's a world of healthcare abundance coming, that actually, through all of human history, we've been assuming scarcity in designing healthcare. Like even the word triage, if you think about it, assumes scarcity. Can't help everybody, got to help one group and not another group. But I think for the first time in human history, because of AI, you can have kind of an infinite supply of clinicians. And we need to think from a world of abundance of how would we use that to truly change health.
Okay, so on the spectrum where Ed is doing something very consumer-oriented and Aashima is enterprise, where are you guys on that spectrum? Are you an enterprise?
We're technically enterprise, because we only sell to health systems, payers, and pharma, who then, when the product calls you, it doesn't say, hi, I'm calling from Hippocratic AI. It says, I'm calling from, Cleveland Clinic, and I'm the AI care manager here to check in on you. So.
Okay, so I'm sure that when everyone hears that you've got an AI that will act as a nurse or make a phone call that a nurse would have made, does that mean you're going to put all the nurses out of business? Or, can you speak, is your AI actually replacing the nurse? Or how should we think about that?
Look, I think that, again, so much in healthcare, we're only able to serve a sliver of people. Like we keep saying we're doing population health, but really we're doing a sliver of the population health. We're doing the 2% that are costing the most, but what about the other 98%? And so I think that as the population of the US ages, there's this false conflict that everybody draws. They're like, oh my God, what are the nurses gonna do? I'm like, do you know there are not even enough nurses in nursing school to keep up with the retirements that are coming, let alone the aging population, let alone that as you age, your healthcare intensivity goes up so much that you need even more care. And so I think in the entire developed world, let alone the ideal staffing, where if somebody were to be checking in more, we would fundamentally be able to do prevention at a level we couldn't do before. And so I think that, I think there's a world where this abundance is going to truly change things, and every single nurse today is going to have a job. They're just going to be doing in-person physical things that the AI can't do. It can't change a bedpan, it can't hold your hand while you're going through a tough time, but that'll be the place for the humans to continue to provide.
Yeah, and I think, when I was talking to your team about this, one of the points they made is that a lot of these calls, maybe the vast majority of them, just wouldn't happen if it weren't for AI, because it's so hard to get a doctor on the phone, so hard to get a nurse on the phone. But now, thanks to AI, we do have this abundance, and you can get your question answered. Obviously, that places a high burden on you guys to get the product right and make sure that all the answers are correct, but that's why there's a market opportunity for it.
Yes, and I call it the sins of omission versus sins of commission. We do hurt patients by not calling them and not checking in post your operation and seeing if your incision site's getting infected. So what we're trying to do is avoid the sins of omission that are happening today in the healthcare system, not just the sins of commission.
And David, this is very consistent with what we are seeing in the ecosystem as well. I'll give a very specific nurse example. We work with HCA. They have 190 hospitals in our country. And in any given day, they have 60,000 handoffs between nurses. So a nurse comes into the shift, they are seeing 8 to 10 patients. At the end of the shift, when it is done, if you walk into a hospital room, there's a clipboard. And there's a handwritten note. They collate that information across those 10 patients. At the end of the shift, spend 60 to 75 minutes so that the incoming nurse will have the full details about the 10 patients. That shift summary, 60,000 handoffs are manual. So what they are doing with AI is to automate that. So imagine, even if they save 5 minutes, the savings are actually much higher for that handoff. So 60,000 into 5 is 300,000 care delivery minutes. So minutes saved in a documentation and burnout is a minute towards care delivery. It's for creating the space for that personal link that is broken, because studies show 28 hours is what a clinician spends on documentation. So when we talk about AI replacing jobs, what we are seeing is actually physicians and nurses are much more open to it, but they're open to it if it's not hallucinating. It's actually reducing the cognitive burden and not adding more to their plate. But that's the burnout crisis. WHO projects 10 million shortage of healthcare workers by 2030. So how are we going to solve for that?
Right. So we have a shortage of healthcare workers. Moreover, patients aren't necessarily getting all the care that they need. They're certainly not able to just call up a doctor and ask questions whenever they want. And so we're going to be able to deliver a lot more health interactions this way. And let me go to you, because you're collecting data that makes patients smarter. How do you view this? I mean, I guess from your standpoint, the more you educate patients, or I guess hopefully they're not patients yet, they're just consumers, you can avoid illnesses in the future.
100%. So at Whoop, we are always thinking about how can we help our members change their behavior to prevent things. And usually it's very simple stuff. You know, it's like get in a little bit of exercise every day, go to sleep earlier. Sleep consistency is really important. A lot of people, myself included, didn't realize how important it is to actually go to bed and wake up around the same time every day. It's easier said than done. But through just these simple behaviors, you can actually prevent some pretty serious diseases. So we kind of think of, sometimes people refer to the Whoop strap as a doctor on your wrist. It's like, it's kind of always there 24/7, kind of observing everything you do. And we have this AI health companion in the app that will actually, every day it'll talk to you and tell you what went well, what didn't go well. Every Sunday, we give you a little recap of how has your health span changed over the last week? Is your pace of aging going up or down? You know, so you can kind of check in and see, like, did I behave in ways over this past week that is making me healthier and adding healthy years to my life, or did I behave in a way that's taking years away from my life? And we believe that by kind of reminding our members in a nice way, we don't want to be annoying about it, but reminding them you can make these small behavior changes that actually can prevent disease. That's how we add healthy years to the planet.
That makes sense. Aashima, let me actually come back to you on the medical records issue. All patients have a right to their data, to their medical information. You have a right to your medical records. But in practice, how did you get them? It was very, very hard. I guess, I don't know, you called your previous doctors and asked them to fax over copies or something like that. It was just very hard to get that data. And that creates a problem in this new generation of sort of innovative healthcare apps. Because for these apps to do the best job, you need to have the data. So I'm curious, how much of a problem are you seeing with that? And are we there in terms of a solution? I know that at the White House, just a couple months ago, there was a pledge that, Munjal, you were there too, where I think it was something like 90 companies signed a pledge to have an open data standard. Can you guys speak to that as well?
David, this is a question very near and dear to my heart. I've been in healthcare for a long time, and when we look into the innovations that are coming in, interoperability is the single most important discussion we can have today. And I first want to thank the HHS team, the CMS Interoperability Pledge, Amy Gleason. They are creating an ecosystem because healthcare is too complex for any one company to take the full onus on. When you think about, I think interoperability in three ways. One you touched on, for example, consumer. If you believe a patient controls their own data, that's a notion that's not well understood or adopted. The data belongs to the institution. And we see the vision where consumer-mediated data exchange, because the new applications are coming. How many apps do you think they're there in? There's an app for everything. There's an app for diabetes, for blood pressure, for mental health, but none of these applications, if you ask how many of these apps connect meaningfully to the medical record, less than 2%. And to me, that means we're creating more data silos for consumers. That's why the interoperability pledge and open standards look for and promote the data liquidity. And to me, if we don't do that, we're going to lose the moment. We fought for last 10 years about data interoperability. We cannot afford going into these AI innovations. They will remain at the surface and not come to or have the potential to go everywhere with every patient. The second on the interoperability, I'll give you another example. If you talk about a chronic condition, let's say you're dealing with diabetes, your patient journey is sometimes you're going to your primary care, and they're using a system built by company A. Then maybe you were hospitalized, and that data went to a system of record built by company B. Then maybe you came home, you went to a lab to draw your blood and see your A1C. That data is built by another company and went to a record C. Similarly, you can add, maybe I want an X-ray. Those are PACS, all these data silos that exist in healthcare. You cannot complete a patient's view and have that holistic understanding of patient. And it won't just start with patient. When you think about community health, I always say inpatient is a failure of outpatient care. Outpatient is a failure for a home health, and home health is a failure for community. So to get that holistic longitudinal data record, these standards are a must. If we don't have that, AI will fail to deliver its promise.
And you said that less than 2% of healthcare apps have access to the patient's medical records. Is that right?
Because there are many apps. How many?
I see.
So.
And does AI help with this in the sense that AI is very good at dealing with unstructured data, meaning the API doesn't have to be perfect.
Yes.
You don't have to map out every field. You can just give it a PDF, and AI just figures out, how to structure the data out of that PDF. So is there an opportunity there to use AI in that way?
You nailed it, David. The complexity also lies when we're asking for data to be shared in a particular format. The legacy data doesn't exist in semantic interoperability, which is FHIR. So where we see AI actually helping, taking an unstructured, converting that, and doing it at scale. This is what AI is good at: data quality, data engineering, data conversion, data transformation. So I believe that moment is here now. We have AI which can actually help, be it these different system of record companies, to actually adopt the standard, leverage AI, and then help build a longitudinal patient journey.
David,
sorry, Ed.
I was just going to say on that topic of using AI to do things like this that in the past would have been almost impossible. We earlier this year launched something we call Whoop Advanced Labs, which allows members to do blood work, and they can either go to local Quest labs and get their blood drawn, or they can upload labs that they've done in the past. And that lab uploading feature, that would have taken our engineering team a long time to build prior to AI, but with generative AI, it was something that the team was able to just build very quickly.
Your users able to just upload their results.
Yeah, users can upload a PDF, a photo, any of that stuff. And without these AI tools, that would have been very difficult to allow users to
because
upload.
you in the old world, you would have had to figure out the format that every single blood lab uses to convey its data, and then you'd have to parse that.
And it's so fragmented, and they're all different formats. And by the way, we're a global business, so we have people uploading labs in different languages. You know, before being able to use AI tools to do this, we just wouldn't have done it.
But it's a combination of AI and policy. It's not just AI alone. If there's and this is what 21st Century Cures Act, where you're required to give the data in an electronic fashion in an API, which was not there before. So AI alone cannot, if there's an information blocking.
Right, no, the company that owns the health record has to be willing to provide the data, but AI makes it a lot, and if they don't, or if they try to create excuses for why they don't, that's a huge problem. So the data has to be unlocked.
Yes.
But AI makes it a lot easier to make it interoperable for companies to talk to each other. You don't have to have the format exactly right. Munjal, do you want to get in on this?
Yeah, you know, I think that we always have been talking about interoperability for so long. And it's like this quagmire that never really seems to get solved, to be quite honest. But I think that I really appreciate for the first time watching, you know, I had a conversation with Oz as he was driving this initiative, and he's like, I've made it very clear to people that you do not want to make an enemy out of me on this one. And it's going to take that sort of, I think, a top-down influence to say, stop the balkanization. There is actual medical malice that happens when you know, a physician A doesn't know about something B that happened to you. We are actually hurting patients, and it does actually make it better if this data can be freed and shared. And so I think that, you know, the needs of the many outweigh the needs of the few here, and we really do need to, I think this is a place where really this city and the policymakers in it can bring a lot of good to the country.
And Dr. Oz at CMS and Secretary Kennedy and Amy Gleason at CMS, they've done an amazing job driving this. So they're the ones who organized that event at the White House a few months ago where we had the pledge with 90 companies participating. So yeah, they're really driving this, and we just have to make the data available.
Yeah.
I'm curious, with your, let's call it AI nurses, do they have access to the patient's medical record? Can they give a more specific answer to a question or a prompt because they have access to that data, or is that still something you're working on? Is that an opportunity for the future? How do you see that?
First things, we don't call them AI nurses.
Okay,
They're not
what do you
nurses.
call them?
Nurse is the term. They're AI care managers. But nurse is a protected term that really, I think, should be reserved for people.
Okay.
But that aside, I think that, yes, they do. In fact, that's why the product works so well, is that we integrate with the electronic medical system of that health system that we're working with or the payer we're working with. We pull the patient's records and we're following up and we're saying, hey, David, you're going to have a colonoscopy coming up, but we notice you're on a blood thinner and you're on this one and we need you to stop it 4 days before, and then we'll not only call you 7 days before and tell you what's going to happen, we'll call you on day 4 and say, hey, today stop your blood thinner, and then we'll call you the day before and we'll say, hey, to start your bowel prep, and then we'll call you that night and say, hey, start your fast. And you know, just-in-time instructions lead to better adherence. And better adherence leads to better care. And so this is, again, what you can do with the abundance of AI. You'd never have a human doing 4 calls to the same person, but the AI can do it.
Realistically, maybe that patient would have gotten 1 call, or they would just...
If that. They would have gotten an instruction sheet half the time.
Right, an instruction sheet on their way out of the last visit, and then, you know, hopefully they don't mess up.
And yes, and if they forgot to stop their blood thinner, then the procedure gets canceled.
Yeah, I think it's just such an important point that, again, that AI doesn't, people are seeing this in way too much of a zero-sum sort of fixed pie way, when really what we're talking about is creating the abundance, creating better outcomes, creating more interactions.
That's right.
There's a lot sort of negativity. All right, I want to shift to things that are potentially in your way as you guys think about the future. And one of them I want to talk about is we have a patchwork now of 50 states who are all running in their own directions on AI. We have over 1,000 bills going through state legislatures right now on AI. Not all of them are health related, thankfully, but we have over 1,000 bills on AI. Over 80 measures have already passed. I think just in California in the last month, the governor there signed 3 of them. It's getting to the point now where we're going to have 50 different regulatory regimes and basically a patchwork instead of a single federal standard. President Trump has come out very strongly in favor of having a single federal standard that makes life more manageable for our companies, for our innovators. I'm curious, is this something you're seeing? Is this starting to get to be a burden for you maybe? And how do you think we should be thinking about this idea of a federal standard? I'll ask all of you, but Munjal, I'll start with you.
Yeah, I feel so passionate about this. Like, for the love of God, please help us and get some federal preemption in place, because I'll give a couple examples. One, we do not want to end up Europe. Europe acted fast. They passed the EU AI Act. If you actually go through line by line in that act, it's almost impossible to comply. It made assumptions that didn't turn out to be true. First of all, it said, hey, models that are above this size should be regulated, below this size shouldn't. We've actually found the bigger the model, the safer it is in doing medical reasoning, because it can just reason better. I'm like, oh, you should have gotten it backwards. You should have regulated the small models, not the big models. Second, they said, hey, if it reads the emotion of a patient, then it's class 4, it's their highest level of scrutiny. I'm like, so it's bad if my AI can tell the difference between my back hurts and my back hurts? It totally should be able to tell that. That's a great feature, but oh my God, if I build that feature, I'm immediately at level 4. So I think you can see a lot of just, ready, fire, aim. It's like you didn't wait to see things play out to make the right. And I think the same thing will happen here if we roll it out. The other part is, here I am, I'm calling patients. And I mean, a patient might be across straight lines because the health system's right on the border between 2 states and they're living in 1 state and I got a patchwork quilt here. And how do I comply? Is it the state where the health system is? Is it the state where the patient is? Is it, and maybe they were in this thing and then they moved over there, and it's just going to be a mess. Now, bigger companies can maybe comply, but the startups will have a hard time complying. They'll run afoul, and you'll basically really make this a less competitive market and a less innovative market. And so I think that we should take some of the lessons from Europe. I mean, we have not rolled out our product there. But we've seen some other, we've rolled out our product and, we're in Singapore, we're in the UAE, we're going into the UK, which, by the way, doesn't have the AI Act because of Brexit. One of the few benefits of Brexit to the UK. But I think that just thinking through this, we have a lot to learn. And I find that sometimes the regulation is just arrogant.
Yeah.
It just thinks it knows things that, honestly, none of us have discovered yet or learned about the technology, its limitations, and if we fire first, we might really, in the end, not be able to help patients as well.
Yeah, I can't resist the opportunity to pile on a little bit about the EU approach, because when they talk about AI leadership, what they mean is that we're going to lead the world in regulation.
That's right.
And we're going to, in Brussels, we're going to figure this out, and then the rest of the world's going to copy our regulations.
Never met a regulation I didn't like. Yeah.
But when we in the U.S. and definitely in the Trump administration talk about AI leadership, what we mean is that we want to have the most innovative companies, because that's where the innovation is happening. We want to win this AI race that we're in, and the way that you win a technology race is you have to outcompete and out-innovate your competitors. You can't just regulate your way to winning it. So we want to be supportive of regulation. And to your point, a lot of this regulation has been done before we even know how AI is going to develop, how it's going to be used, what the real risks are. There's a lot of hypothesizing about risk, but not a lot of gathering of the data. And a lot of this regulation has ended up being very knee-jerk. And I think that that's what's happening at the states right now. And it would be a really good thing if we could figure out a simple federal framework to preempt this. Aashima, what do you think?
From Google perspective, we also agree with that. We believe in a pro-innovation framework which is built on a federal standard. If you don't do that, to your point, you're creating a patchwork of 50 different ways to govern an AI. And I always say healthcare and sickness doesn't know state boundaries, and neither should the guardrails that govern that AI. And we are seeing, by the way, in practice, national solutions being deployed. So I'll give you an example. We worked with American Society of Clinical Oncology. They have 50,000 plus oncologists and ASCA members. And they create guidelines for diagnosing and treatment of cancer. And over the past 6 months, they're leveraging Gemini, and they've ingested these guidelines. These guidelines, one guideline is maybe 100-page long. And across different types of cancer, you're talking about thousands of pages. So they are now creating this AI agent to help oncologists across different state lines. It's a national solution. It doesn't mean the person who's in Nebraska gets a different standard of care than you're in California or Florida. So to me, this is where, if we want to democratize knowledge, medical insight, we need to have a federal blueprint for folks to follow.
Right. Ed, do you have anything you want to add?
I agree with what all has been said. I mean, federal standards are critical here, I think, for two main reasons. Without them, there's just too much friction to the end consumer. As has been said, if you're like, I'm in DC today, I'm in Massachusetts tomorrow, is it going to be a different experience? That just adds unnecessary friction. And then for companies, if you're having to build flows for 50 different states, it just stifles innovation. And we've got to be innovative and move quickly. We've got to keep things simple. So agree with what's already been said.
Right. Well, we have a few minutes left. I want to just throw it open to you guys. Is there anything else that we in government, I'm sure there's a lot of people here who are involved in government or policy making, is there anything else we can do to help unleash innovation, to make your lives easier in terms of bringing your products to the public? What else should we be thinking about? Or what is it that Washington maybe is not thinking about that you guys think that we should be?
I think there's two things I would say. One is, Medicare Advantage is one of the biggest value-based care systems, period, in this country. And yet, a lot of our preventative work to date has been focused on what I call high acuity, low volume interventions. So we've said, we'll go after the really expensive people with this really expensive nurse because it costs so much to intervene. But I think we haven't realized that AI might be the answer to truly unlocking prevention by being able to go after what I call low acuity, high volume interventions instead of low volume, high acuity. And I'll give you an example. So in the heat wave in New York this summer, we called thousands of patients at the hottest 2 hours of the day, did a heat stroke assessment, called an Uber and got them to a cooling center if they were having issues. We would have never done that with humans. You couldn't have found enough people to do it. You couldn't have made those phone calls. It would have cost too much. You probably wouldn't have offset it with the ER admissions that you avoided. But with AI, the math pencils, the reach pencils, the volume pencils, so I think we should think about kind of a whole new thing. The second part is we have some legacy regulations driven, I think, a lot by the IVR era, where certain things you can bill for if a human calls, but you can't bill for if an AI calls. Because they were worried that I would just robo-dial a bunch of people in an IVR sort of setting and not really complete the care action, not get your blood pressure successfully. So they said, hey, let's not allow that. So like in the case of remote patient monitoring, which is lately a bigger challenge, but for other reasons, but there's a really interesting ability here to say, oh, today if I call with a human, I can bill a certain number. But what if I call with the AI and it's just as effective at getting the blood pressure from the person who didn't upload it? Well, mission accomplished. Now, you don't have to let the AI bill at the same rate as the human. In fact, I would recommend against that. The CMS and HHS should save money if the AI is used. That should help us to lower our deficit and lower our costs in running the system, but we should allow it to be used. And I think that, I know that actually Oz and Chris Klump in particular within his team have been very supportive of just finding regulations that need to be modernized and that were maybe left over from a past era.
Ed or Aashima, do you guys have any things you want to add? Or?
I very strongly believe for AI to succeed, the data needs to be liquidated. So the work that you're already doing with the interoperability pledge, I believe, as someone mentioned, we've been in this data interoperability journey for a decade. How long can we wait? What incentives, conditions can we create for people to be able to willingly participate in that? Because as I mentioned, AI is in a country where our costs are going up, I was listening to the panels, our lifespan is going down. AI is our hope. And finally, there is no AI strategy without a robust data strategy. So we cannot lose the sight. Google is an AI-first company. I love AI. I live and breathe it every day. But we can't, we need to highlight the data dependency for AI to work.
The thing I'll just say is, one thing we've seen is prevention through behavior change works. We have an engineer on our team who, when we released HealthSpan internally, he was so motivated by it that he lost 50 pounds in 12 weeks, just tracking his Whoop age every week. And so I think anything we can do to get more Americans to pay attention to their health, whether it's with Whoop or other wearables, whatever they can do to change behavior. Not to mention we have, the federal workforce is millions of people. Anything we could do to get more of those people also taking these actions, I think can really have a huge impact.
Terrific. Well, I want to thank all of you for joining us today. I think all of you have great stories about how you're bringing innovation to the healthcare space and how you're using AI in a positive way. I think it's really important for people to hear those stories. And I want to thank also the whole MAHA movement, because this movement, I think, has been on the cutting edge of prioritizing prevention and also increasing transparency and empowering patients. And I think we've seen that all today with your stories. So thank you to all of you. Thank you.
Thank you.